We are talking of 2001. Where were you 2001? Is it not FMC? So where are you from now? Those ones, they are people who mind them. You just divorce it. You will see this thing here. Where are you from now? Then the university. So they are college now. Where are you from, man? I'm from the okay. And well, the consultants are here. You are not the one who are going to why am I asking? You see as John. You see as John. And who we have thus is that, you know, some people came from other facilities, and the essence is for them to acquire the knowledge and go back and set up in their own place. So part of the training, part of the strategy is to how to empower other centers on how to set up similar service in their center. So we can't just people that just come from outside. We are sure we are going to have a very nice time. I think it should be below. Okay, it's open now. Okay. That's it. So let us play the ground rules, because most of the time when we are doing training like this, people engage in their own affairs. They engage in their own affairs by chatting, watching movies, go on WhatsApp. That may affect concentration, because if you come here 100%, you might realize that you are using about 30, 40. So we want everybody to concentrate, and that is why we want to put these rules down. We have wasted a lot of time already, and we wasted a lot of time already, and we need to be fast about it. The number one thing or the rule is that each participant must have a full attendance. Full attendance to be able to acquire the CME or CME point or the certificate. What we have learned in the past that people will just come in, they don't complain, they go and they say that okay, they have done it. Because we are giving out 10 points of CME. It's a lot. And it's very, very important for you to actually understand what you are doing. And not only that, let us honor those people who invested in this training. Make sure it's worth it. So everybody must mark the attendance sheet. The attendance sheet must log in twice daily. You have logged in now. It is also compulsory to attend the pre and post test. I understand that some people have done the pre-test online, but it's also very important. Pre-test is where are we coming from. Post-test is what you have gained. So it's very important to actually evaluate yourself. And this is what they are going to also use to evaluate us, that people actually gain. The other one is, please let us restrict movement so that we don't distract people. And please keep your phone in vibration. And there will be other information we will continue to share as we move on. I'm sure people are already started feeling it now. Please, Nigeria for you. So the teaching method we want to adopt, we have been doing this thing for long period of time. In fact, our first thing was 2005. You can remove 2005 from here now, you know how many years ago. Most of the training we be doing it using didactic method of teaching. People will just come, listen, within 2-3 days they are forgotten. So this time around we don't want to use a didactic teaching. This time around we want to really do a practical thing. What we need to do is to construct learning together. So don't expect us to teach. We are not going to teach you. What we are going to do is to facilitate the learning. All of us know what palliative care is meant for. You must have seen 1 or 2 people who needed palliative care. You must have even managed some of them. So we want to gain from you. You also gain from us. So it's going to be participatory and it's a social constructivist learning method. Then we are going to work on adult and pediatric. There will be a lot of reflection because I mentioned interactions. We do also experience. We want to learn from your own experience. That's what we mean by experiential learning. With that, it's very easy. You don't need to join anything if you really want to put it in your brain, because it's not a lecture. Then we're going to use patient as educator, both physically and case-based problems for patients. And we expect feedback medicine among yourself, feedback mechanism for the facilitators, and we hope in future, if you are much interested, we can assist in mentoring. You are free to come to us so that we can have more experience than other this experience that we are going to have. So we have a flyer and the just be around pediatric, ethics in palliative, grief and bereavement, complementary alternative therapy, communication skills. We are going to family conference, in the family, breaking bad, clinical placement, bedside, and then you are going to visit our clinics. We run clinic and we run oncology pain clinic. As a matter of fact, we are blessed with this department saying that we are the only center in Nigeria. I think even for now, we actually started integrating palliative care, palliative medicine into HIV medicine. We actually started the clinic as far back as 2006. And we have been there. I know that some of you will ask questions. Why do you do palliative care in HIV/AIDS when they are alive? You will see the reasons. We'll tell you some of it. And of course, you see the patients. But we will also try to maintain confidentiality. I have some pictures here that I would love to show. I think I should try to abridge the lecture because it is very, very important for you to see, because the more you see, the more you appreciate.